My name is Jonathan Santos-Ramos. I'm Chief Program Officer at Care for the Homeless, and I've been here 1.5 years. My role is to oversee our residential services and health service delivery, as well as our operations and our human resources department. I have been in healthcare administration for the last 25 years. Most recently as interim executive director of a federally qualified health center network in New York City. I've been in healthcare work. I started as a peer educator back in the mid-90s, mostly around HIV when at the height of the HIV pandemic, and it sort of snowballed. I started in health education, and then it really grew from there, and I've dedicated pretty much my whole life, at least my adult life, to healthcare administration. I've always been somewhat connected, if not directly, but sort of adjacent to homeless healthcare. And this was an amazing opportunity to marry my knowledge of federally qualified health centers with really focusing on the work that Care for the Homeless does, not only on the shelter side, but integrating health into what we do on the shelter side and for the homeless community at large. So it was a perfect opportunity for me to connect not only my experience, but my expertise. Homeless folks often experience many comorbidities, and having to address those comorbidities can be complicated when health is not at the top of folks' minds. And so we really have to meet folks where they are to be able to provide as many of our services as possible, and that way we can be able to eventually get to a place where they're living healthier lives. That was very much the approach in HIV prevention in the mid-90s and beyond. CFH's work is extremely important. I think that we do things very uniquely and have a unique position of being able to provide the whole compendium of services, from shelter to healthcare, both medical and behavioral health, dental, but also supportive services, housing, assistance, eligibility, enrollment, and a host of things like health education, and really sort of helping the whole person to be able to live healthier lives and eventually, hopefully, gain permanent housing. The biggest thing for us right now is really making sure that poverty isn't perceived as violence, right? And because many of our clients are coming off of the street and are being treated as if they're some sort of criminal, and they're not. They are whole persons, and we are very fortunate to be able to welcome them into our spaces with open arms, but really needing the support from all New Yorkers to be more sensitive to folks living on the streets and in the shelter system.